Assalamualaikum warahmatullahi wabarakatuh. Good day, everybody. We met again. I'll continue my uh, my presentation uh, from this if, from this morning. I'll talk about the cardiorenal syndrome. This is very important syndrome. We should know about that. Not only the uremic toxin will damage myocardium, but all of the material or situation in the renal conditions can make myocardial damage also. Yeah, I'll repeat one again. The renal physiology. Yeah, I think to remember you. But nephron, I think I've said this morning. Glomerulus is very important apparatus here. Yeah. Renal innervation, only sympathetic nerve activity. There's no evidence of parasympathetic innervations. Filtration rate, yeah, filtration about 180 liter a day or 125 milliliter per minute. This is, we should know what the three basic renal process, as I said this morning already. Renal blood flow, also I have said this morning, and also the renal filtration rate is very important. Filter depend on the net filtration pressure and the constant that is hydraulic permeability and surface area. If there is glomerular remodeling, the constant become decrease, and of course filtration rate decrease also. That is the net filtration pressure in the renal corpuscle in the normal subject. You can compute the filtration rate by yourself. Not so difficult. That is autoregulation. Once again, this is the medication we usually use ACE inhibitor, ARB, and calcium channel blocker. Beta blocker also. But we should know about the indication, mode of action, and side effect. Usually I said there should be a dynamic balance between yin and yang, but in case of endothelial dysfunction and glomerulosclerosis, the yang is very dominant. Look at here, it's endothelial 1 and decreased nitric oxides. Yeah. It will cause endothelial dysfunction and glomerular hypertrophy, and then glomerulosclerosis. Okay. We should know also uh, about the condition of the hemodynamic in patients with hypertension. In the early of hypertension, there is some vasoconstriction of the afferent artery and not for the afferent. So what's happening? Filtration rate will decrease. But in case of chronic hypertension, it's quite different. There is increased fast afferent resistance. Uh, and what will happen? There is a hyperfiltration of the glomerulus, and the filtration rate will increase. As you know that the fast afferent glomerulus and afferent normally 20 fast afferent 20, glomerulus 5, and the fast afferent 11. The mean pressure, that is normal condition, but everything will change in the case of hypertension. Look at here, systemic hypertension with uh, increase uh, with increased intraglomerular, which result in intraglomerular hypertension and then hyperfiltration, and the glomerulus become glomerulosclerosis, and then nephron loss will happen, and the normal nephron will take over, but it will uh, do hyperfiltration also, and then become glomerulosclerosis. So this condition happen in case of something like chronic hypertension. Yeah, essentially. There is stages of diabetic nephropathies we should know. Yeah, that is stage 1, 2, 3, 4, 5. Look at here. Stage 1 and 2, you can use any uh, antihypertension drug. But the stage 3, be careful. There is some uh, micro proteinuria already. So the ARB should be less than vascular-selective CCB to decrease the fast apparent resistance. Yeah. And this stage 4 and 5 could be acid and ARB can zero, and the uh, antihypertensive drug we use vascular selective only. Yeah, yeah. That is the combination. Look at here. For renal protection and renal preservation, we use ACE inhibitor, ARP, and vasoselective CCP. And for the coronary, we use ARP, ACE inhibitor, and beta blocker. Don't forget that. Recent recommendation for renal complementary action in specific tertiary definition. Cardiorenal syndrome is a physiologic disorder of the heart and kidney whereby acute or chronic dysfunction of one organ may include acute or chronic dysfunction of the other. Biomarkers are also involved in the pathophysiology process. That is type of cardiorenal syndrome, type 1, 2, 3, 4, and 5. We can monitor here the creatinine serum, the urine production, and the filtration rate. Yeah, that is type 1. Type 1 is acute condition of the heart will result in abnormality of the renal something like acute kidney injury. The heart is acute mechanical infarction or acute heart failure. Usually we use ACE inhibitor, ARP, and very strong vasodilator, and each will result in decreased renal function. So it will result in acute kidney injury. Yeah. That is protein biomarker for the early detection of acute kidney injury. Yeah, usually we use cystatin C and creatinine serum. Next, type 2, chronic heart disease will cause acute or chronic uh, renal disease. Yeah. For example, congestive heart failure will cause acute tubercular necrosis or acute or chronic CKD. Okay. This type 3, that is the referred one, the acute renal problem will cause acute and chronic cardiac problem. For example, hypertensive heart failure, arrhythmia, acute kidney syndrome, and so on by the very uh, uh, peri mechanism. That is the staging of acute kidney injury, Arcadia, the status reach, injury, failure, and so on. And we monitor the urine production, KFR, and serum creatinine. This is type 4. Chronic kidney disease will cause some heart disorder, like acute coronary syndrome, arrhythmia, and so on. And the type 5, this is more complicated. Here, there are some systemic disease involved there. So it will, so I told you, it become more complicated, and usually the prognosis become worse. The summary actually is not very difficult to make a diagnosis of cardiorenal syndrome. But the problem here is how to determine the primary disease. And in treating the disease, for example, in case of acute coronary syndrome or acute heart failure, usually we use ACE or ARB, and the very powerful vasodilator. What's happening? It will bring the pressure go down rapidly and extremely, and it will result in deterioration of the renal function or acute renal acute kidney injury. And the other one is, for example, chronic heart failure needs water restriction, but chronic renal failure need more water. And the last one is if there are some systemic disease involved there, the condition become very complicated and the prognosis become worse. Okay. Once again, thank you very, very much to you for watching and listening my presentation. Wassalamualaikum warahmatullahi wabarakatuh.